At some point, people stopped trusting healthcare. Not because doctors are bad, but because the system stopped listening.
Patients are not just a number. They're a human being. You gotta take care of them.
I've worked with a lot of professionals. The ones people trust most aren't the ones who talk the most. They're the ones who slow down and listen. That's why this story mattered to me. Before the clinic, before the lab coat, Dr. Ali didn't come from medicine.
Before lab coat, before I was Dr. Ali, I was basically a medical assistant. I was working with Dr. Faraj as a medical assistant for about 4 to 5 years. And then before that, I was a server at Habib's restaurant.
Serving tables taught him what most people never realize is a skill. Communication, reading people, and staying calm.
First off, I was a server, and that's where I believe I gained my communication skills. I would talk to so many individuals, so many customers, back and forth, basically.
He didn't choose naturopathic medicine because it was trendy. He chose it because he saw what rushed care looks like.
I was able to transition from a restaurant business to a medical field business. So I became a medical assistant for about 4 to 5 years. And I would see patients where I would give them vitamin B12 shots, take their history intake, medications. I'd be doing a lot of things in that field to a point that I applied to naturopathic medical school. I knew that this profession was going to be a little bit difficult when I graduated and came back to Dearborn, Michigan. Naturopathic medicine is more of a medical approach to healing the root cause of an issue rather than just a symptom itself. And with that, it's going to take time. So especially in our community, they want a faster approach. The reason why it takes time is because herbal medicine, holistic medicine, there's no medication, there's no chemicals involved. We are basically allowing our body to heal itself at its own pace. That's what some individuals don't understand, which I am trying to teach them. I'm trying to show them that, hey, it's gonna take time, but I promise you, when it hits, it hits.
Some beliefs don't come from school. They come from watching people you love suffer.
Yeah. Definitely had some family members with cardiovascular issues that I definitely remember when I was a kid. They're close to home. I would be in the hospital with them, and I would see the way that medical doctors would handle certain situations, and I would like the way they would handle it, but then there would be areas where I would dislike. I would see my family member in a lot of pain, and I would see nurses take their time. They take their time to finding a medical doc to come and see their patient and give them the proper medication. So that one definitely stayed with me throughout.
When pain waits, trust disappears. Over time, Dr. Ali noticed something. People didn't come to him for a quick answer. They came to him to be understood.
A lot of patients come in here and they're upset or they're tired. And they come to me and they're like, Dr. Ali, you're my last resort. I went to so many doctors. I would tell them what I had. They give me this medication, it doesn't work. And then they say they don't know what else to do. Then they come over here and they speak to me, and I keep asking them questions. And the way I look at them as they are speaking, they're speaking with a smile. They're speaking like they are being understood. So that way when I give them a treatment and they walk out happy, a couple days later I might get a phone call or get a text message. Hey doc, I'm doing phenomenal, thank you so much. I appreciate what you do. That's what patients need. They need somebody to listen. Somebody to understand what they are going through. Patients are not just a number. They're a human being. You gotta take care of them.
Most people assume doctors are supposed to know everything instantly.
They assume that we know everything. They assume that we know the right treatment to give them right away. But a doctor is also a teacher. A doctor is also an investigator. And investigators, they don't get it right away. There has to be a proper doctor-patient relationship. It takes a lot more than just one symptom for doctors to know what the issue is, especially with naturopathic medicine, because we're trying to get to the root cause. So when I have a patient coming in with one symptom, I'm over here asking 20 to maybe 30 questions to try to understand more and more. That's because I'm trying to get to the root cause.
And that time is something most systems don't reward. When someone sits across from him, they're not just hoping for medicine, they're hoping to be seen.
They're really hoping that I see that they are struggling and they need help. They're really hoping that I see what is going on and that I can treat it. They want to be heard, they want to be believed, they want to be helped. If they weren't heard, they won't listen to your treatment. They won't listen to your plan. Why would somebody listen to you if you're not hearing them out? Sooner or later, they're gonna be like, oh, he just wants my money. He doesn't want to help me.
There's a fear most patients rarely admit.
The truth? I feel like most patients might know what they have going on, but they don't want to believe it. And so they don't want to say it out loud. They don't want to believe that they are in trouble with their health. They want to believe that everything's fine with them and they can continue living their life. They don't want to believe they're in pain. They'll feel broken, and then they'll feel like because they're broken, it's going to be hard to put them back.
Because once you admit something's wrong, you have to face it. This is where people finally show up, after being told everything looks normal, but still not feeling okay.
A lot of people come to me, show me lab results. Doc, my doctor told me that I'm okay. These lab results are really good, but I still don't feel like I did from before. I still don't feel healthy. Can you take a look at them? And I see, yeah, they're within normal range, but sometimes they're on the low end or the high end. Just because you're within normal limits doesn't mean you're necessarily okay. That's something that we have to look into a little more. That's where I come in. I have to figure out what is the root cause, what is going on.
That's where most people get stuck, and where he steps in. He's careful with his words, but he's not afraid to be honest.
Should I answer that? I mean, pharmaceuticals, man. I'm gonna say it, big pharma. People know it's all about medication. A lot of MDs, a lot of DOs work based off of symptoms, and whatever the symptom is, they pair it with that drug. People are starting to wake up. They're starting to understand that not every symptom needs a drug. Drugs have side effects. One drug creates a side effect for another area. Sooner or later, you're gonna have a list of all these drugs. There are a lot of individuals think that I'm against drugs. To be honest, I'm not.
And he's just as blunt about natural medicine.
A lot of people think that just because something is natural, it's safe. That's not the case. And I always tell that to my patients. Some herbs that interact with each other that causes an upset stomach, low blood pressure, low blood sugar. Individuals, whichever medicine they are doing, should be talking to a doctor at first and understand what they're going into.
Belief doesn't come from theory, it comes from seeing it work.
I had a patient who reached out to me and told me that she has stage 4 kidney disease. Her kidneys are not filtrating properly, and they're below a certain number. I treated her with a natural supplement, a natural herb. She used it every single morning on an empty stomach. 2 to 3 months later, she called me and she told me, hey doc, my GFR went up. It went up 10 points, 11 points. That right there showed me that there is hope, that naturopathic medicine does work. The key to it is patience and consistency. Another patient, he's 84 years old, on dialysis. left knee pain. He was using cane before, put it away. He started walking faster. And he called me a couple days later and told me, hey, I have more energy and my urine flow is great. Alhamdulillah, patients having positive feedback from natural supplements or natural herbs gives me the ultimate confidence that what I'm doing is correct.
For anyone watching this who's lost trust, not just in healthcare, but in their own body.
Stop, take a deep breath, look around, look at where you're at, and it's not over. It's not over, your life's not over, you can still get better. One thing is not working, that doesn't mean your life's over. Just continue. Keep moving forward. Positivity, confidence, and patience. The more positive you are, the more confident you become. And the more confident you become, the patience just flows along.
Sometimes healing doesn't start with medicine. It starts with being heard.